Welcome, everybody. My name is Dr. Jeremy Thornton. A little bit about me. I am a chiropractic physician. I am a board certified internist, board certified clinical nutritionist. Been in practice here in Southwest Missouri for this month is 28 years. That doesn't seem possible. Um, but my kids are old enough that I realize that is possible. So I have two graduating, one from high school, one from college. So they quickly remind me that I'm getting older. Anybody have that problem? So, but I'm excited to share with you today about this amazing triGLP technology. It's something that came across my pathway back in December. This is actually a brand new technology that just came out in November, December. I had some testers be able to try out the product and then rolled it out in December. My good friend Tanya shared this with me, and honestly, guys, I was not excited about a peptide product, right? How many people have just been inundated with, peptides? It's all we hear. And I had tried a few peptide products that never worked for me. And I tried many, many, many weight loss products that never worked for me. So I didn't have a lot of faith that this would be any different. So I reluctantly tried the drops. And what got my attention is that over the holidays, rather than gain weight, which I always do, anybody else with me on that, they gain weight over the holidays, then they try to lose it right before spring and summer roll around. Um, I had actually lost a couple pounds. And so it shocked me. And I'm like, okay, wait a minute. What is this stuff? I never lose weight over the holidays. And so I dove in, checking out the technology, checking out the ingredients, checking out the company. And what I found just blew me away. We talk about three pathways, and we're going to dive into those pathways and talk about what that means. We hear a lot about GLP-1. I know that not all over the world allows advertising on medications like they do here in the U.S. I know we have a large Denmark population with us today. Welcome. But I don't think over there they allow people just you don't have commercial after commercial of pharmaceuticals, do you? I don't think I don't think in the UK, EU, I don't think that's allowed, which is smart. But here in the US, we hear like every other commercial is about a GLP-1, and by far one of the most popular pharmaceutical on the market. So GLP-1, when we hear the term GLP-1, we've been taught to think that it's a drug, right? That it's an injection. The GLP-1's an injection, the most popular being Ozempic. So with the equal GLP-1 with Ozempic, and that's simply not true. GLP-1 is a natural pathway, a natural peptide, or a hormone, you could call it as well, in our body. It's already there. Okay. So GLP-1 is not a drug, not a medication, it's not a supplement. It is a pathway that our body already has. And so the injections significantly drive that pathway pretty aggressively sometimes. Anybody had somebody that experienced side effects with the GLP-1 medication or know somebody that did? Most of us know somebody that has had a side effect. And now it's getting to the point where we're hearing, about lawsuits, right? About company lawsuits of side effects. I've personally seen patients with GLP-1s that had lost weight. A big percentage of that was muscle. So they say up to 40% of the weight loss is muscle. That's devastating. So if somebody loses 50 pounds and 20 pounds of that is muscle, right? Are they metabolically better off after losing 50 pounds or worse off? They're worse off, right? And so they've lost 50 pounds. 20 of that was muscle, lean muscle. And now they've lost that weight, but now they are more metabolically unhealthy than they probably ever have been. That makes maintaining that weight loss very difficult. And so, especially if they did not incorporate any, healthy lifestyle changes, if they go off that shot, they rapidly gain that weight back, right? And we've probably all heard somebody that's done that. I had a patient that did that, went back on the injections again to get the weight back off. Well, guess what? She lost another 20, 30 pounds of muscle after the original 20 or 30 pounds of muscle. Because guess what? When they gain that weight back, do they gain that 20 pounds of muscle back? No, they don't, right? So here they are, 20 pounds and maybe another 20 pounds of muscle lost. And you could see where this can easily get into a critical situation with health. And we're seeing that. We're seeing not only effects on muscle tissue, we're seeing effects of GLP-1s on bones, osteoporosis being a big possibility. We hear a lot of people having digestive upsets, chronic constipation, gallbladder issues, pancreatitis, all these types of things. And that doesn't mean that the medication is bad. My opinion, which it was of course designed for diabetics, not for weight loss, was designed for diabetics, is that it has a place, but it's overused. And I really feel like it's overused when we have better and natural and safer alternatives, right? So the GLP-1, I got off on a rabbit trail there. GLP-1 is a natural pathway that suppresses and regulates hunger and appetite. It controls that at a neurological level. It slows the gastric emptying. And if we're not moving things through as quickly, of course, we're going to be full more easily and for longer. So it reduces food cravings. It promotes sustainable weight loss without effort. It also reduces inflammation in the body. It improves insulin resistance in the body. And those are all amazing things. But not only are our drops supporting the GLP-1, we're not forcing it. And that's one thing I always tell people I want them to remember is that we're not forcing physiology like injections do. They force and they drive physiology pretty hard. We're supporting physiology with this technology. So the GLP-2 pathway, right? It's already in our body. Again, it's not a drug. It's not a supplement. It's a peptide or a pathway in our body. We call this one the core shield. Let me move this around just a little bit on my screen here. So it repairs and strengthens the intestinal barrier. It actually has been shown to help reverse a condition called leaky gut. I don't know if you've ever heard of the term leaky gut, but it's a real situation where the cells that are in our gut that are normally tight together like this start to spread apart a little bit, largely from stimulation of a protein called zonulin. They spread apart and they allow things that aren't supposed to be passing through this intestinal barrier to pass through into the bloodstream. And that your immune system is not happy with that. Okay, that drives a lot of other issues in the body, can set the stage for autoimmune disease. The GLP-2 supports and strengthens that barrier and that epithelial layer inside the intestines, reduces gut inflammation, reduces systemic inflammation in the body. It enhances nutrient absorption, supports your good guys in the gut, right? Promoting healthy digestion, healthy immune system. I've seen already people reporting that improvement in gut. We see that a lot. If you're not in our testimonial group, please ask whoever invited you to send you an invitation to the testimonial group because there's so many testimonials in there that have nothing to do with weight loss, right? Many of us probably were interested in this conversation because of that, but what we're finding is that this is so much more than just fat loss. I'm seeing patients report that they're able to eat foods that they used to be sensitive to, right? And that goes back to the whole leaky gut situation. My wife, who used to be horribly gluten sensitive, now she can tolerate a little gluten. Now she's not going on, back on a gluten diet where, because she doesn't feel great when she eats gluten, but she used to swell up and be miserable. And, even if she ate food that touched gluten, right? And so we're seeing a lot of digestive improvements um, across the board of different digestive conditions. We won't name diseases. We're certainly not trying to cure or treat diseases, but it makes sense, right? If we support this barrier and we reduce inflammation in the gut, that we're going to help an awful lot of things. Another thing that I'm seeing, of course, is improved energy levels. We see this all the time, even improved mood, improved outlook. And one of the things I believe is causing that is this GLP-2 pathway, right? We're supporting gut health. We've heard the gut called the second brain. Anybody heard that? The gut creates 90% of our serotonin, 50% of our dopamine is made in our gut. So it makes sense if our gut's happier, our neurotransmitters are going to be better balanced, and we're going to be happier, right? Also, it improves nutrient absorption. And I think this is a big component of why people are seeing so many different health improvements is because we're absorbing our nutrition better. And And that's a big deal. One of the things that has been measured with this product is improvement in iron levels in the body, iron uptake in the body, again, largely because of this pathway here and healing that intestinal lining. So those are two pathways, but we're not done yet, right? This amazing technology supports three pathways. So there is also a GIP peptide in our body. This again is already in our body. We are supporting that with this technology. The GIP optimizes insulin sensitivity and glucose regulation in the body, prevents blood sugar spikes and energy crashes, normalizes energy throughout the day, enhances fat burning and metabolic efficiency, supporting sustained energy and mental clarity. One of the exciting things about this, by supporting this pathway, we're telling the body, which may be stuck where it wants to store everything, the fuel that's coming in, it wants to store that away, right? And by supporting this GIP pathway, we're telling the body, okay, we don't have to store everything that's coming in. Let's start using some of this as energy. Let's start burning some of this for fuel in the body. And so we're creating a metabolic shift in the body by supporting this pathway. And one thing that I'm excited about just in practice is I'm seeing already, of course, this hasn't been out very long, right? So the patients that I first started using this with were just now starting to do some follow-up labs, right? Now we're here in early May. And so I'm starting to get labs back and seeing improvements in fasting insulin, improvements in A1C, lowered triglycerides. And why is that? This is one of the main reasons the GLP-1 and the GIP are connected with insulin sensitivity and glucose regulation in the body. And so this is huge for chronic health conditions. In the U.S., 1 in 3 are pre-diabetic, 1 in 8 are diabetic. Um, I know we have a Denmark in the house here. I know that you guys probably aren't as bad as we are, but I'm sure it's up there. And the estimated 70% have insulin resistance. And and so if we can impact this, this is huge. And probably if this was all it did, this would be groundbreaking. But it does much more than that. And because of course blood sugar problems drive pretty much all of our other major health issues, heart disease, cancer, um, neurodegenerative conditions, right, are tied in some form or fashion to blood sugar regulation and increased risk with diabetes and obesity. So, key benefits of the triGLP clinically has been showed to have a 6 to 7% BMI reduction in just 6 weeks, 10% body fat decrease with zero muscle loss. That we should highlight that zero muscle loss, not 10% muscle loss, not 20, 30, 40% muscle loss, zero muscle loss of that 100% fat targeted weight loss, and not even water weight. It's all fat. Improved glucose, like we talked about, improved A1C, sustained energy, inflammation decreases. This is another one that I didn't touch on probably enough. And another area where I'm really shocked at the level of inflammation that this is impacting in people's bodies. It's another thing that I've been able to appreciate on follow-up lab testing is reduction in inflammatory markers, and that's super exciting. And so we're seeing people notice less inflammation in their bodies, being able to be more mobile, have less pain, less chronic pain, less inflammation. One thing that I'm seeing, and this isn't about making medical claims for our product, but I'm seeing improvements in autoimmune patients. And that's probably the biggest thing that we treat here in our clinic. And the reason I think that that is likely back to inflammation. If we can impact inflammation in a big way, it makes sense that we're going to calm down the immune system in a lot of these conditions. Again, leaky gut is tied an awful lot of times to autoimmune. And if we're impacting leaky gut and gut health in a major way, we're also going to shift the tide potentially in various autoimmune conditions. And so it's exciting to see some of these testimonials roll in with things responding and conditions responding that we would have thought that this could touch, but it is. Um, why is triGLP different? We have 3 years plus of research and development. Of course, there's no needles, right? We're not poking ourselves weekly. Patented bioavailability technology, pharmaceutical grade manufacturing standards, direct to consumer, right? We don't have to go to our physician to get a prescription. No medical gatekeepers, right? And about a quarter of the price, at least here in the US, of GLP-1 prescriptions or injections. Effortless appetite control without restricted diets. Of course, we recommend healthy eating. You don't recommend McDonald's and your drops, right? But gut healing for complete digestive wellness, perfect metabolic balance for sustained energy, comprehensive transformation of mind and body. So this is for you if you want to lose weight naturally, you don't like needles, you want affordable GLP support, you suffer from food noise, you want to switch from shots to a natural solution. I have many, many patients, right, that are been on the shots or are on the shots that are seeing they're either having side effects or they're hearing about side effects, right? And they want an off ramp without gaining their weight back. This is an awesome option for those, right? To utilize the drops as a way to transition off of the shots, and that can certainly be used in that way. They want to maintain their weight loss. They want to keep their muscle. And maybe they want to help launch a viral product. And we're not going to dive into that today. That's outside of today's conversation. But if you are entrepreneurial minded, there is an opportunity here for you as well. A very clean product, which I love, is that this doesn't have, usually when you have anything in a liquid, they combine it with a carrier oil or in a tincture, they add alcohol. And that's not the case here. This technology, there is only the bioactive peptides from the salmon, organic lemon peel extract, organic ginger extract, and water. That's all that's in this bottle. That's all that's in these drops. So I feel very safe in recommending this across the board, even no matter what age we're talking about, right? Because again, I'm going to mention Americans. We have a lot of unhealthy youth. I see kids as teens that are already pre-diabetic and diabetic type 2 diabetic. That's not a great way to start life, right? And this is something that could be safe for even the youth to improve metabolism, all the way up to elderly. There's nothing in here. The body sees this as food. This food just happens to support these bioactive pathways in the body that create a metabolic shift in a healthy direction, right? The purity of this product, again, free from antibiotics, additives, it's kosher certified, pesticide free, HACCP certified, halal certified, non-GMO, it's GMP certified. Is probably, and I pride myself on clean products as working with nutrition, right? I don't want to give our patients synthetic, junk that's out there. Um, and this is probably the cleanest product on my shelf. And I already only use clean things. But the certifications of here, it's just beyond pure, beyond organic. And why is this a perfect time for a natural breakthrough? Well, 10% of the population is already on GLP-1s or GLPs in some form or fashion. 30 to 35% are looking into it. They're interested. They want support. Maybe they are hindered because of the reports of side effects, or they don't like the idea of needles. So we're entering a U.S. market of more than 100 million consumers that are seeking GLP advantages, but hesitant to pursue injectable options. Uh, the global GLP drug market size began at 48 billion in 2024, 66 billion last year, and projected to be at 880 billion by 2034. As you can see, which we've already talked about, theirs versus ours, injectable versus natural. Um, the main thing is, again, we have an option, right? If people need injections, if they're diabetic and they need those, that's one thing, right? But to have a safe option that doesn't require prescription, that doesn't require injection, that doesn't have those side effects, is a big deal. And to have something that's pure, that's clean, um, that doesn't have questionable ingredients and additives and preservatives and all the things, it makes this a powerful option. I'm going to exit my screen here. And so that is why I am super excited about this technology. I'm super excited to get opportunities like this to share it with others because more people need to know about this. This is a new technology that's just launching, actually still pre-launching, really, and just reaching other shores from beginning here in the U.S. Of course, the salmon didn't start here in the U.S., did they? The salmon are from Norway, and the extraction process, the technology used is just second to none. And so I appreciate you guys for joining me today. I'm going to wrap up this Zoom and wrap up this recording, and I appreciate you guys for being here today.